here at the San Gabriel chapter of OFA. We've been discussing the Affordable Care Act, aka Obamacare, and I've been thinking about what it personally means to me that this law is passed and that's going into effect. For me personally, as someone who is in business for myself and has to buy insurance on the open market, I've already had wonderful changes happen. My insurance has gone down. The free preventative care with no co-pays has meant so much to my pocketbook and just encouraging me to go get regular checkups. But the most important thing for me personally with the Affordable Care Act is the not being able to deny people anymore if they have a pre-existing condition. My father died about 20 years ago of cancer. He had a good job. He was a roofing contractor. He got a better job. He was extremely happy about going to a new company, but he had 3 months to wait until his insurance took effect with the new company. And this was back in the 80s. I don't even think we had COBRA then. Most people just waited till their insurance kicked in with the new company, and that's what they did. During that 3 months, my father found out and was diagnosed with bone marrow cancer. And so from then on, even though he had a good job, he had a pre-existing condition and was denied health coverage. I am so grateful to the President, to the Congress for passing this law, because as of January 1st, people like my father and their families will not have to worry about this. If my father were alive today and this happened, he would have a health insurance coverage. And so for my dad's memory and for all kinds of people like that, I am so happy we have the Affordable Care Act, and I will do everything I can to help people become aware of it and get signed up, and I'm real excited.
And I'm a volunteer with Organizing for Action, which is a nonpartisan, nonprofit organization trying to educate people about a number of different issues. My particular interest is in the Affordable Care Act, or which is otherwise known as Obamacare. I'm particularly interested in this issue for a number of reasons. First of all, many of us have been through periods of unemployment. I certainly have. And one of the first things you find when you lose a period of employment is you lose health care. Not all employers provide health care, but those that do, when you are suddenly unemployed, you're scrambling to figure out how to pay for health care and what to do. It's very expensive. I'm sure we've all understood that. That's a major concern of mine. The other reason is that I have a huge concern about what is happening to the middle class in America. The middle class is what makes us strong, what makes our country great, and it always has been. It's an important backbone of our democracy. One bad illness, one bad accident can just bankrupt a family with the present healthcare system. So we're looking to have people understand more about Obamacare so that they understand the many benefits it will have when it kicks in, and enrollment starts October 1st. I'm very glad to be here in California, where we've been in the vanguard of setting up the healthcare exchange at the state level. They are doing a great deal of education about how this new act will benefit you and your family. I want you to check it out and look for enrollment possibilities starting October 1st. Again, I think this is a really critical issue to the health and welfare of all Americans, and I hope you feel that way too, and that you will learn more about it when you visit the website, coveredcalifornia.com. Thank you.
I'm from La Puente, California, and I'm a recent college graduate from NYU. I'm back here in California living with my mom, searching for a job. I'm currently unemployed. Before Obamacare, I would be not able to have health insurance because I'm not employed. But thanks to Obamacare, I have the opportunity to get subsidized health insurance and also qualify for Medicaid, and that's going to really benefit me. No one should have to worry to get sick or not getting taken care of because they're unemployed. And for my mom's case, she's over 65 and she's using Medicare. And the great the way Obamacare is affecting her is positively is she doesn't have to worry about prescription medication costs because of the closing of the donut hole. Before then, she would have to pay tons of money. So I think the most important part about Obamacare is the peace of mind for me and for my mom. And so I'm grateful for that, the Affordable Health Care Act.